See, you need to understand this surgery. This is not like band or sleep. This is not obstructive. This will let you eat, let you drink, but at times you will feel your dizziness, weakness, sometimes gas in the abdomen. Basically, it is pushing out your oil. You will literally see oil getting out in the, your water. Did you notice that?
A little bit.
Yeah, it will come. And then it will control the sugar. If you take a lot of sugar, your sugar can go down. ਜੇ ਮੰਨ ਲਓ ਕਿ ਕੱਪ ਆਈਸਕ੍ਰੀਮ ਦਾ ਰਹਿੰਦਾ ਠੀਕ ਹੈ, ਜੇ 3-4 ਕੱਪ ਖਾ ਲਏ ਤਾਂ 15-20 ਮਿੰਟ ਬਾਅਦ ਤੁਸੀਂ ਦੇਖੋਗੇ ਘਬਰਾਹਟ ਹੋਣ ਲੱਗ ਪਈ, ਤੁਹਾਨੂੰ ਯੂ ਵਿਲ ਨਾਟ ਫੀਲ ਗੁੱਡ। ਸੋ ਯੂ ਨੀਡ ਟੂ ਕੋਰਿਲੇਟ ਕਿ ਕੀ ਹੋ ਰਿਹਾ। ਬੇਸਿਕਲੀ ਇਹ ਜਿਹੜਾ MGB ਆ, ਇਹਨੇ ਤੁਹਾਨੂੰ ਕੰਟਰੋਲ ਕਿਵੇਂ ਕਰਨਾ, ਇਹਨੂੰ ਅਸੀਂ ਕਹਿੰਦੇ ਹਾਂ ਫੰਕਸ਼ਨਲ ਰਿਸਟ੍ਰਿਕਸ਼ਨ ਹੈ, ਫਿਜ਼ੀਓਲੋਜੀਕਲ ਰਿਸਟ੍ਰਿਕਸ਼ਨ ਹੈ। ਤੁਹਾਨੂੰ ਇਹਨੇ ਰੋਕਣਾ ਕਿ ਵੀ ਆਹ ਚੀਜ਼ ਤੁਹਾਡੇ ਲਈ ਚੰਗੀ ਨਹੀਂ ਹੈ, ਕਿ ਤੁਸੀਂ ਫਿਰ ਉਹਨੂੰ ਖਾਣਾ ਪਸੰਦ ਨਹੀਂ ਕਰੋਗੇ ਵਾਰ-ਵਾਰ।
So I went to the bathroom 3 times.
Yeah.
Don't get lucky.
So that one it is to maintain a diary. Just note down what you are eating and how you are feeling.
Okay.
If sometimes you feel I'm not feeling good, then just try to correlate what you ate. And in a matter of around 2 months, you will understand the surgery very well, and it will get you towards Mediterranean kind of diet. So basically, this is the concept. This is something very latest in bariatric surgery about weight loss. Whenever I talk about weight loss in international conferences, this is the thing which we are now, projecting, that we don't want these bands or sleeves. Doctors have tried jaw wiring. If you search on the internet, they have tried jaw wiring 60 years back, and that was not a success. So if you cannot lose weight with jaw wiring, how can you lose weight with band? And there is 70% failure with band. So any kind of restriction, if you try on a patient is going to cheat it. Then we'll say you're taking soft calories, you're doing this, doing that. But this is physiological restriction. You will not like something, which is not good for you. Fruit, grilled chicken, grilled vegetables, boiled vegetables, steamed vegetables, they're all good for you. Fried vegetable, fried chicken, you don't feel good with that. 1 cup ice cream is good, 3 cups not good. So ਹੌਲੀ ਹੌਲੀ ਇਹਨੇ ਤੁਹਾਨੂੰ ਮੈਡੀਟਰੇਨੀਅਨ ਡਾਇਟ ਵੱਲ, ਹੈਲਦੀ ਡਾਇਟ ਵੱਲ ਆਪਣੇ ਆਪ ਹੀ ਤੁਹਾਡਾ ਜਿਹੜਾ ਬਿਹੇਵੀਅਰ ਆ ਆਪਣੇ ਆਪ ਚੇਂਜ ਹੋ ਜਾਣਾ। ਅਦਰਵਾਈਜ਼ ਲੇਟੈਸਟ ਰਿਸਰਚ ਇਹ ਦੱਸਦੀ ਹੈ ਕਿ ਤੁਸੀਂ ਡਾਇਟ ਚਾਰਟ ਜਿੰਨਾ ਮਰਜ਼ੀ ਫੋਲੋ ਕਰ ਲਓ, 2-3 ਮਹੀਨੇ ਤੁਸੀਂ ਫੋਲੋ ਕਰਦੇ ਹੋ, ਉਸ ਤੋਂ ਬਾਅਦ ਆਪਾਂ ਨਹੀਂ ਕਰ ਸਕਦੇ।
Basically, I don't know.
ਫਿਰ ਆਪਾਂ ਕਹਿੰਦੇ ਆ ਫਿਰ weight ਵੱਧ ਗਿਆ।
3 ਕਿਲੋ ਦਾ ਗੇਨ ਹੋਇਆ।
So that is the reason. ਤੇ ਬੈਂਡ ਤੁਹਾਡਾ ਕਦੋਂ ਹੋਇਆ ਸੀਗਾ ਬੈਂਡ? 2008 ਦੇ ਵਿੱਚ। ਉਸ ਤੋਂ ਬਾਅਦ ਕੁਝ weight ਤਾਂ ਘਟਿਆ ਹੋਣਾ ਇੱਕ ਵਾਰ?
ਬੇਸਿਕਲੀ ਆਪਣੇ ਆਪ ਘਟਾਇਆ ਸੀ, ਬੈਂਡ ਦੀ ਡਾਈਟ ਕਰਨਾ ਦਾ ਜੀ, ਇਨਫਲਕਸ ਆਉਂਦਾ ਜੀ।
ਅੱਛਾ।
If lose ਕਰਾਉਣਾ normal ਹੋ ਜਾਂਦਾ।
Yeah, this is another thing which we need to talk about. If you put some restriction here, then you'll have reflux. Band ਹੋ ਗਿਆ, sleeve ਆ, ਜੇ ਜ਼ਿਆਦਾ tight ਕਰਦੇ ਆ, patient ਜੇ ਖਾਊਗਾ ਤਾਂ ਉੱਪਰ ਆਊਗਾ, and that is something which we do not want at any cost. So we have acid or stomach ਦਾ, it should not come back in the esophagus. ਤੇ ultimately ਇਹਦੇ 'ਚ ਕੀ ਹੈ, MGB ਤੁਹਾਡੀ ਜਿਹੜੀ opening ਆ ਉਹ wide ਹੋਊਗੀ, 5 centimeter ਦੀ outlet ਆ, ਇਹਦੇ ਤੁਸੀਂ ਖਾਓਗੇ ਉਹਨੇ ਆਰਾਮ ਨਾਲ ਨੀਚੇ ਚਲੇ ਜਾਣਾ। So ਜਿਹੜਾ ਇਹ acid reflux ਵਾਲਾ ਕੰਮ ਆ, this is anti-reflux procedure.
Okay. Second thing I noticed with the accelerated there, even the liquids from the stomach to the intestine is moving pretty fast.
Yeah.
So is that normal?
Yeah, that's normal. Yeah.
Okay, so
it takes time to settle. The intestine will adjust.
So the food
adapt.
So the food intake, how long does it usually stay in the stomach before it moves to the?
See, that is the trick in MGB. Food doesn't stay in the stomach at all. Basically, now we have converted your stomach into a tube.
Okay.
So now your stomach is not like the stomach which it used to be. It is now just a connection between the intestine and the food pipe. Next. See, this is your stomach now. All the food pipe. A stomach.
That's a. What's on top of that? That's a esophagus.
This is the connection. of this is esophagus.
Okay.
This is the tube, stomach tube.
Yeah.
This is the connection between the esophagus and the stomach tube. Actually, this was the area where the band was inserted.
Okay.
So ਇਹ ਬੈਂਡ ਵਾਲਾ ਏਰੀਆ ਹੈਗਾ, ਇਹਨੂੰ ਅਸੀਂ ਜ਼ਿਆਦਾ ਇੱਥੋਂ ਟਾਈਟ ਨਹੀਂ ਕੀਤਾ ਕਿਉਂਕਿ ਇੱਥੇ ਜ਼ਖਮ ਸੀਗੇ ਕਾਫੀ ਬੈਂਡ ਨੇ ਕੀਤੇ ਹੋਏ। I could have trimmed it further like this,
Okay.
but then the chances of leak would have been 10 times more. So that is what we do in the band patients. So do not touch that area where the band has caused erosions already,
Okay.
so that it heal. So we are rather close this area in 3 layers so that it should not leak. So everything is perfect now. There is no leak. Now we can see if there is leak, the dye will go out. Or otherwise, also patient will have pain and fever. So this is your tube. And see this connection you can see. This is the intestine. MGB the picture Khanna. See esophagus, gastric tube, and intestine.
So it's the same gastric tube as a sleeve.
Yeah, this is the gastric tube as a sleeve, but with a bypass. So this is a sleeve plus bypass. Obstruction, they are totally against it. There is no obstruction. Like you had a band was here. It was obstructing whatever you ate. It was obstructing here.
So does the new stomach?
This is the new pathway for the food, but it's not a reservoir.
So it doesn't
It
create any
cannot-
acids and like that?
Yeah, it will produce some acid because the acid is there always, in stomach, some acid is produced. Even this stomach, which is now bypassed, it's on side. This will also keep on producing acid, and all these juices will come and touch this point.
So how many ounces a milliliter do you think the new stomach is?
The new stomach is now just acting as a feeder to the, intestine. The food is right away falling into the intestine, and then this changes your behavior towards different kind of foods.